Hello, hello, hello.
Righty. Alrighty. Well, so we let people coming on in. Alrighty, we'll give people a few more minutes to come on in to the live before we go ahead and get started.
This Facebook.
Give them one more minute and we will start.
All right. We're going to start in a couple minutes. We thank everybody who is on so far. If you have any friends or family, please contact them. Let them know that we're going live with information about COVID-19, the COVID-19 vaccine. In your comment section, you can start to place your comments and your questions. I see my big brother is on, my only brother. All right. Please tell all your friends, your neighbors that we're about to go live with the COVID-19 vaccine information.
Mhm. And definitely send us your questions. We're so excited for our special guest that we'll be bringing up very soon. And we're going to get some real factual information about the virus as well as the vaccine, and what we can do to make sure that we're taking really good care of ourselves with this. All righty. So I think we'll go ahead and get started. Thank you for all of those who have tuned in. And I think you'll go ahead and feel free. Give us those questions. You all have questions. We know you all have questions. So please feel free to drop those in the comment section. We will be able to get with you. So Lewis, do you want to introduce our special guest today?
Absolutely. We have a special guest. I consider him a friend, but he's also my mentor in regards to medicine, someone that I was blessed to contact during my time at Baylor College of Medicine. He is well known here in Houston and the state of Texas as a great family physician, as well as a great administrator of medicine. So we are just so happy and delighted to have the one and only Dr. Brian C. Reed with us. Hey,
Hi, Dr.
Dr. Reed.
Reed.
Hey, good afternoon or good evening.
Mhm.
Good
So much
evening.
for having me.
Yes,
Yes,
sir.
yes. So before we get started, Dr. Reed, if you can, we know all about you. I was telling Lewis how great it was when I was an intern, a lowly resident intern in my first couple of weeks of residency. Lewis was chief resident, and you were attending at the time of the inpatient group, and you all came down to that ER at Bentom, and I was there just working. I just remember looking over and feeling like this is the dream. I finally
Yeah.
made it. Just feeling so proud, to have these strong Black men that were so intelligent heading up the service at that time. So, like I said, Lewis and I, we have stood in awe of all that you have accomplished. But if you could give a little bit of background to our viewers about your training and kind of where your position is now.
Sure, sure. Well, thank you again for having me. So, I'm a family physician by training. I grew up in the Sugar Land area, and I went away to school to the University of Michigan for undergrad and medical school, and then did my family medicine training at Henry Ford Hospital in Detroit. And it had a urban focus. And with that training, I was able to come back here to Houston and start working at Baylor back in 2002, and worked my way up through the department, being a medical director at one point of a Harris Health System clinic, vice chair for the department, and ultimately interim chair for the department. Before I left Baylor and Harris Health, I went to Harris County Public Health and was division director over one of the human health areas during Hurricane Harvey and led some of the effort for the Hurricane Harvey relief at NRG Stadium. And now I'm one of the department chairs over at the New University of Houston College of Medicine. There we have a focus on primary care, as well as reaching out and serving medically underserved communities. So it's been quite a journey, and one that's been a reward, filled with reward and blessings. And look forward to continuing to serve Houston and Harris County in this capacity.
Okay, well, that sounds really, really great. Again, thank you so much for being with us. So we're seeing some of the questions go ahead and come on into that comment section. So we'll just start off with a simple one, for us to be able to answer for our group here. So the first question, how does the COVID-19 vaccine work? How does this work?
So this is an interesting one. It's a new technology. So I guess we're kind of backing up. We've been doing research on coronavirus vaccines for decades. We've had to push things to the forefront because of what's happened to the world with COVID-19. But there have been investigations in terms of how to prepare a vaccine against coronaviruses going back to previous outbreaks that didn't necessarily affect the entire world. So we've seen SARS, which was mostly over in Asia, MERS, which was in the Middle East, and different forms of other types of coronaviruses in the past. But this one, of course, COVID-19 or SARS-CoV-2 has affected the entire world, and of course has brought about so much death and disability and hospitalizations and so many changes in our lives that this kind of pushed us to work sort of globally on a solution, a way to sort of prevent things. So this one uses what we call as a mRNA messenger technology. It is not live COVID vaccine or COVID virus. We're not infecting or shooting people with coronavirus to generate an immune response. What this does is basically it uses your body's own cells to produce that spike. So usually when we see the coronavirus, we see that ball with the little spike on it. This uses what we call messenger RNA. So we inject the recipient of the vaccine with the injection. The cells receive it, see it, produce a protein spike, that little ball, and then your own body produces antibodies and reacts to it and produces, its defenses, so that basically the next time it sees it, it can attack it right away. So if it sees that ball and spike formation, if it actually sees coronavirus, your body mounts an immune response right away. So sometimes I've heard it referred to, or an analogy, basically we're sending the body of the blueprint. It produces a response to that spike, and then almost has like a wanted poster. So the next time it encounters it, it immediately attacks or immediately jumps on it. I've also heard someone say, or it also described as something like Instagram or Snapchat, really sort of Snapchat, where once your body sees the message, it reacts to it and then it disappears. So this actual vaccine, it doesn't leave like a long-term trace or anything like that. It's just your body produces antibodies to it. It does require 2 doses. So the Pfizer vaccine, right now, individuals are getting, the healthcare professionals are getting it. Usually they'll get the second dose 21 days apart. Moderna, which was just approved, I believe Friday, uses similar technology and requires 28 days between the first and second doses. And usually to get that high effective immune response, you would need those 2 doses. These first 2 vaccines have been demonstrated to be about 95% effective. I mean, these are much more effective than the flu vaccine. So it's very promising. Now, there are other vaccines that are in the works, and probably in the coming weeks and months, we may have additional vaccines on the market. But right now, we've got two that look to be very effective.
Yeah, that was really helpful. Just describing, and one of the questions we did already receive was, is this a live virus or not? And you
And it's
answered
not.
that it is not. It's not going to give you, we're not giving you the actual COVID-19 virus. That's not what is in the vaccine. Yeah, I guess we can go on to the next question here.
All right, the next question, will this mRNA vaccine modify or insert into my DNA?
So that's a great question. So the simple answer is really sort of no. It doesn't kind of interact or intertwine with your DNA. As mentioned sort of before, your body takes it, uses the protein to basically make that protein spike, or reads the directions, makes the protein spike, but then the mRNA actually disappears. So it's not supposed to be leaving any sort of long-term changes to our own structure, our own anatomy, or anything like that. Some preliminary reports that we've seen is that with the second dose, not oftentimes with the first dose, the second dose, which usually is a larger dose than the first dose, people have experienced some flu-like symptoms, a little bit of fatigue, some body aches. Usually people have some local pain at the site, but it should not affect your own DNA or make you sick long term, or have any sort of the ramifications that we see with the the actual COVID-19. I myself haven't got the vaccine yet. I'm trying to basically get in line. I'm not really at a hospital at this time. I'm working in outpatient centers, but several of my colleagues and friends have received the vaccine. Many have gotten it through Methodist. I've seen some with Herman, Texas Children's, and Harris Health System that have received it, and all of them are doing just fine.
Yeah.
And I've had others that were actually in the studies, in the clinical trials, and the worst thing that they had said was maybe a day or two after the second dose, they felt a little run down, but fully recovered with no issues.
Yeah. And so just to be clear, that second dose is like a booster shot almost. We are priming the immune system with that first shot, that 21 or 28 days later, depending on which vaccine you get. That's just more like the booster shot, just to make sure that you're mounting that full response to it. So we did get a question here as we were talking about the side effects. So can we talk a little bit about Bell's palsy? That's been one of the side effects that it's been potentially mentioned.
Yeah, so it's not necessarily a widely thought of side effect. I've seen it circulating around the internet quite a bit, but from what we've seen from the actual clinical trials themselves, it's mostly sort of fatigue, sort of low-grade fevers, and some body aches, and not so much Bell's palsy. Bell's palsy is it's thought to be a viral infection affecting the facial nerve, and it results in when someone goes to the ER with Bell's palsy, what may appear to be a stroke, because it results in weakness and paralysis of the muscles on that particular side of the face that's affected. So oftentimes when someone has Bell's palsy, they will have a facial droop, as well as their eye may be closed, and it's usually pretty dramatic on one side of the face. People do recover from Bell's palsy. It's not like a long-lasting condition. Oftentimes we treat it with a steroid and a antiviral, some of the same antivirals that we use for the treatment of herpes. We'll use that to help mitigate any sort of Bell's palsy if someone does develop it. I would try to mimic it, but I probably would want to rehearse it. But I usually think, it's oftentimes someone, they just kind of look like a pirate because their face is, one eye's closed, and, and it just doesn't, there's no speech impediments or anything like that. It's temporary. The actual cause of Bell's palsy is, again, thought to be viral, but they're not, 100% certain of it. And we occasionally see with the flu vaccine, again, it's not necessarily been said that, oh yeah, if you get this COVID-19 vaccine, you're going to guarantee yourself to get Bell's palsy. That's not one of the top side effects that we're seeing.
Right, right. And I think what people, what the information and research was showing for the clinical trials, when they were looking at those subset of people who had the vaccine, there were some of them who did end up having occurrences of Bell's palsy. But when we look at the general population, that same rate of occurrence that people were having Bell's palsy in that clinical trial is the same rate that we see in the general population with people who don't get the vaccine.
Yeah.
So it's with one of those things where it's like, oh, more so, okay, it happened during the study, but it's not because of the
No
vaccine.
causation.
Yeah. So I think we'll go ahead. We have a question here. Let me pull this one up here.
All right. This is my only brother, big brother. His question is, my question is, how fast can you get the virus again after recovery?
So that's a good question. So we've already seen this year people get it more than once. And I know this year seems like it's been 2 years or 3 years long. This virus first showed up on our shores at least in the United States late January, early February. So we did see some individuals with case reports of getting infected and ending up in the hospital more than once. So we've seen individuals that, were positive, sick with pretty severe COVID-19 in the hospital, and then back in the hospital again in July or August. So we are basically the best estimate, because again, it is a new virus, is that our immunity lasts about 4 to 6 months is what the thinking is. So people that have gotten the virus that say, okay, I don't need a mask and I'm just going to walk around with it, you might be setting yourself up to get it again and get it, potentially worse the second time around.
Right.
So, our best strategy is to, good public health measures, washing your hands, wearing a mask when out in public, staying home if you don't feel well, and when the vaccine is available, of course, get the vaccine. But just because you might have contracted the virus earlier, that does not mean that you should let your guard down.
Yeah.
I have a follow-up question on that, Dr. Reed. How soon can you get the vaccine after having recovered from COVID-19 virus?
Yeah, so they're recommending that people wait 90 days or 3 months from the time in which you have contracted the virus and tested positive, and then getting the vaccine. So we've seen that sort of play out right now, and we'll actually see it. So we had last week, we had a public display, I believe Friday, where Vice President Pence and the outgoing, second lady got the vaccine, but we've not seen our current occupant of the White House receive the vaccine, and it's not likely because he wound up with the virus and would be advised to wait at least 90 days.
Yeah. And so that's a kind of follow-up question that we have. If I've already had COVID and recovered, do I still need the vaccine?
Yes, that's a great question. We would recommend it. Again, we don't have years and years of data on how our bodies respond to, the actual COVID infection. We don't quite know how the immunity lasts. Again, kind of going back to the previous question, we've seen people contract it twice. So if this allows us to kind of give our immune system a boost without contracting the virus again, this would be a much safer way. So we would recommend that those that have been infected get the vaccine when it's available, as long as it's been at least 90 days. I think part of this goal is, it all kinds of goes back to, public health measures. We were challenged this time because it was novel. It's brand new. Anytime you hear anything novel, that's a big problem. That's the first time that humans have seen it, and we don't know how our bodies are going to react to it. Looked to be just a, mild thing at first, but the sheer numbers of the amount of people that are contracting this virus, it's proven to be more contagious than the flu. and behave in ways that the flu does not behave. And even though only a small percentage of people are dying, but we have this big of a number, the percent, it doesn't matter. I mean, we've had, 3,000 people dying a day. So we didn't have a vaccine to start off with, and we didn't have a really good means of protecting ourselves against it. We tried to mitigate things by locking things down and keeping people at home and keeping people away from each other. And, it didn't quite work out as well, at least in this country, as it did in other countries. So, the strategy would be to at least vaccinate enough people to where the virus just won't have a host, and get the number or the amount of virus circulating in the community to decrease to where it's, much more manageable, and we're able to truly isolate and keep people away from each other if they are sick. I mean, right now we just have too many people in our communities throughout the country with being ill. I believe our positivity rate in Houston is getting close to 10% or maybe even above 10%. So it's, their goal all along was to have it under 5%. We never got there. And when we have, this many people walking around with the virus, especially with this pre-symptomatic phase to where people don't have fever, don't feel bad, but are spreading it, it really presented a challenge. So the idea is that if we are able to vaccinate enough people, the cases will drop, just be much harder to contract the virus, and we'll be able to go back to being normal.
Yeah, that's really, really good. I did want to propose this question. What ages can get the vaccine, and can children get the vaccine?
So that's a great question. So right now, these two vaccines that are available, they're not available for children. So the Pfizer vaccine, I believe, is 18 and up, and the Moderna vaccine is 16 and up. I may have those crossed up, but either way, no one under 16 is supposed to be getting these vaccines. I'm not sure if the other vaccines that are in the pipeline included children in their clinical trials or not. Most of them did not include pregnant women in their studies, but the American College of Gynecologists actually said that they should go ahead and immunize pregnant women, despite the fact that they were not included in the clinical trials. So they don't have much data on pregnant women. There's no data on children, but they are nevertheless recommending that pregnant women do get the vaccine, because we have seen COVID in pregnant women, and we don't want an adverse outcome for a mother or the child in utero. So it's that the American College of Gynecology has made that recommendation. As we administer this vaccine, we'll go beyond the tens of thousands or hundreds of thousands of people that have been already included in the clinical trials and the safety profiles. So we'll steadily be building the amount of data on what happens when someone gets the vaccine. So that too gives me some confidence in terms of the safetiness as well as effectiveness of the vaccine. And they have a special program of what's called V-Safe. So after you receive the vaccine, you have to kind of input your symptoms so that they can continue to track how you're responding to the vaccine. So we're getting information from around the world on these two vaccines.
Yeah, Vanessa, thank you so much for that question. Hopefully we get that answer, but definitely this is something you would want to talk about with your OB-GYN if you're currently pregnant or thinking about getting pregnant or even breastfeeding. This is a matter of kind of weighing those risks versus benefits for your particular case. So definitely have that conversation with your OB-GYN. And even just for the rest of our viewers today, our goal today is just to make sure that we're equipping you with the information so you feel prepared to have that conversation with your primary care doctor about receiving the vaccine when it is offered. We have another question here.
All right, this is from Jackie Morris, Mom Morris. If a person who has an underlying condition, how will it affect them? If a person has an underlying condition, how will it affect them?
So right now, we are having some, nurses as well as doctors receive the vaccine, and many of them have high blood pressure, obesity, some diabetes. And thus far, we've not seen any sort of adverse reactions beyond the most common things, which were sort of, maybe flu-like symptoms, um, uh, which was documented in the clinical trial. Now, they did exclude, some people with underlying conditions like, I believe, COPD from some of the trials. So we'll be gathering much more data as people receive the injection. What we do know is that catching the actual virus itself, again, this is not live virus, it's not dead virus. Having those underlying conditions such as diabetes, hypertension, obesity, or sort of chronic lung disorders could potentially lead to a worse outcome, meaning hospitalization or even death. So, we definitely want to prevent those things.
Definitely, definitely.
We have another question. If I have seasonal or food allergies, can I get the COVID vaccine?
Yes, that's a great question. So, the first day that they were administering the vaccine over in the United Kingdom, they had 2 severe allergic reactions. These were people that have had a history of severe allergies, but they didn't actually spell out what they were allergic to. And I believe also in Alaska, we had someone that had a pretty severe allergic reaction to the vaccine, but they did not have any sort of documented history of allergies. This vaccine is not made in similar ways as some of the flu vaccines have been made. They used eggs in the past to help with production of flus. These 2 vaccines don't have any sort of link to any sort of food, peanut or anything like that. So seasonal allergies and food allergies, they're not a reason for not getting the vaccine. They're not what we would call restrictions or any basically exclusion criteria or anything like that. So yes, when it's available, you should be able to receive that.
Yeah, yeah. So I know that kind of, I think from the as you were saying, we don't really know exactly what happened over there and exactly what they were allergic to. But if you've ever had what we call anaphylaxis, meaning that they had to give you an epi shot if you got a vaccine in the past,
Yeah.
then you wouldn't want to get the vaccine. But if you have like a peanut allergy, and yeah, we've had to use the EpiPen on me before, you're safe. You can go ahead and get the vaccine. All righty. Let's see here. Other questions. If people are typing in questions, let's ask this one. We have one here.
All right, we have this question. Are the mRNA vaccines specific to viral strains or general to a class of virus? And if it is specific to a strain, does that mean follow-up vaccinations will be required as new strains develop? That's an excellent question.
Yeah, that is a great question, and I think that's sort of highlights one of these advantages for the mRNA vaccine. So when we look at a flu vaccine, we basically monitor the southern hemisphere because they have winter at the time at which we have summer, and we look to see what sort of flu virus is circulating in that time of year, and we modify our own flu vaccine every year to kind of match what we guess is going to happen in the winter and fall here. The mRNA vaccine, this particular protein spike that we're producing is unique to the COVID-19 coronavirus. But if it were to mutate with this sort of technology, we would be able to pretty quickly modify the instructions and maybe change the shape of the spike in case there are new, more virulent, more deadly strains or more contagious strains. We would be able to sort of modify these vaccines pretty quickly. It wouldn't require years of development. And I think in the future we would sort of see, just like the flu vaccine, changes as the environment sort of dictates.
Yeah, yeah. Okay. We have another question here. From Miss Crystal, all the way in Chicago. Hi, Crystal. How often is the vaccination needed? So let's say, Dr. Reed, I were to get the vaccine January. When would,
Yeah,
is there any research as to when I would need to get it again?
great question. We don't know yet. I mean, I think right now we're just trying to get it out and get people immunized. Hopefully, the cases will drop to the point that maybe we won't have to have, the vaccine later on this year. But some of the preliminary information that we've gotten from these clinical trials is immunity is projected to last about 4 to 6 months. So in my head, just sort of thinking, I'm like, well, I may have to get it a second time this year. But, if enough people get it and there's not as much virus circulating, then maybe not. So we don't have that information yet. I think right now it's almost like they're kind of keep giving us hope and not telling us we're going to be locked down through Easter or anything like that. It's like, well, just give us a couple more weeks. So, I don't know.
All right. Our next question. If I get the vaccine, do I still have to wear a mask and social distance?
Yes, so that is the recommendation. It's that we should continue to wear masks and social distance until we have, significant decreases in the cases. Again, the vaccine is 95% effective, which means that, some of us would still, a small percentage of us, but some of us could still contract the virus. And there's also some concern that even though we are protected, what if we carry a little bit of the virus and spread it to others? We ourselves are not getting sick, but, others, as a carrier of it, we could potentially spread it to others. So our guidance at this time, at least until we have a significant decrease in the number of cases, is that we will continue to wear masks and social distance. And this will likely go on for a couple of months. I mean, I don't anticipate us being here forever wearing masks and social distancing. This is, I think, an important step to kind of getting us back to normal. I think most of us in the sort of public health arena or experience in public health, when this showed up in the way it showed up, we were like, probably 2 years. In all honesty, this is looking so bad, and I think, probably, hopefully by the time we hit this holiday season next year, Thanksgiving and Christmas, with enough people vaccinating and decreased cases, we'll be able to have some family gatherings and things again.
Yeah, I know one thing that was interesting because full transparency, when I was hearing that, as much as how, especially as it's been politicized, that, oh, we're going to have a vaccine by the election. I said, well, hold up.
Yeah.
Wait,
Yeah.
you know how long it usually takes, for vaccines. But one thing I thought was really interesting to hear, we call on the wet bench side of the development, that this mRNA vaccine had been in the works for about like a decade, but they were still just trying to figure out, the best ways to use it. And then when COVID came around, how to isolate it where we can produce that spike protein. So it's not like, oh, they just, everybody rushed into the lab at the same time 2 months ago to develop this. The actual kind of vehicle, the mRNA vaccine, had been in the works for a decade, and they had been proving that it was safe even then. So we have another.
That's a good point. I mean, I didn't believe it either. And I got some inside information from my health department colleagues, and they were telling me that between the week between Christmas and New Year's, and this was back in November, that it was going to be here. I was like, I don't believe it. But it's actually here beforehand. So, it's going out around the world. So
We have a couple more questions here.
All right. This is from my mom, Miss Audrea Gilbert.
Hi, Mama G.
Older transplant patients, should they take the shot or take the vaccine? Older transplant patients.
So that's a really good question. So that one I would say would have to be a conversation with either your primary care physician that knows you well, or if you're still under the care of a transplant team, the guidance for that, because they did not have transplant recipients in these clinical trials, And, I'm not sure about if you're still on any sort of regimen of, immunosuppressants and things of that nature. So that one would really be sort of a one-on-one conversation with the person that's helping to continue your care.
Okay.
So I have a question here that I know has been proposed. How much will the vaccine cost?
All right. That's a great question. So it's supposed to be free.
Right.
It's supposed to be. Now we'll see what happens once we start getting out. But it's the government is supposedly have provided, put up the cost and paid for it. So it should not be costing anything. I could see where they may try to at least charge like an administrative cost, like the nursing that actually administers the injection. But those usually are like $10 or $15. But the vaccine itself is supposed to be free at no cost because it's being provided to these clinical offices from the manufacturer. It's not costing these different healthcare systems any sort of funding. Yeah, it's interesting to even raise that because I mean a lot of these COVID-19 tests, a lot of those were kind of included in the CARES Act.
Right.
So why people are getting charged some of these outrageous costs for some of the testing doesn't smell right to me either, because a lot of these some of the tests that are out there in some of these clinical spaces were provided by the government. So yeah.
Speaking of tests, we have another question here. How accurate are the COVID tests?
So we have what we call is the gold standard, which is the RT-PCR test, and it usually takes a day or two to get the result back. What that is where we are using that nasopharyngeal swab. So we're basically putting the swab into your nose all the way through the nose till it hits the back of the throat. Very uncomfortable. But that test is the most accurate test in the sense that if it is positive, it's almost certain to be positive. What they do is they send it to the lab, they look for small viral particles, and they actually amplify it to see, is that little speck truly a virus or not? And sometimes what happens with the virus is that, it colonizes and it continues to multiply and grow. So some of those initial swabs, if there's not much virus on it, it comes back as a negative, but it's a false negative. So that RT-PCR test that takes a couple of days is usually pretty reliable in terms of if it's positive, it's definitely positive. And if it's negative, oftentimes it's truly a negative. The rapid antigen test, which is what we are sort of seeing sort of widely around, where you get the result back in 15 to 20 minutes, if it's positive, it's actually detected some viral particle. So if it's really sort of early in the sort of case, it may actually produce a false negative test. So if it's positive, usually can be pretty sure that that rapid test is positive. But those rapid tests, the negative, if it's a negative test, we're seeing it's about 50% false negative. So for individuals that come in with fever, cough, runny nose, body aches, and they have a negative test, oftentimes we send that second test off to the lab to verify and confirm, because it may be a false negative test. So both tests, pretty much, if you get a positive test, you have it. The rapid test, there's questions about it truly being negative. These home kits that are now about to hit the market are also challenged in terms of their accuracy. So if it's a negative test in these home kits, it may not truly be negative, especially if you have all the symptoms. And the home kits are not quite as good at picking up the positive test. But if it is positive, even with a home test, then you probably have a pretty significant viral load.
Okay, so we do have one more question here, probably before we wrap on up. Is the vaccine safe for individuals who have undergone chemo and radiation therapy within the last 4 years?
So again, I would say that's a conversation for your primary care provider or your team that's still caring for you. They did not have individuals that had the chemo and radiation in those clinical trials, but sort of just based on the makeup or composition of the vaccine. Since it's not a live virus, it's not a dead virus, I don't see why it wouldn't be, especially if it's been 4 years and you've recovered. So my assumption would be is that it's safe, but again, that is a conversation for your own treating provider.
Dr. Reed, you gave some really good information today. But one thing, a part of being a part of the African American community, is we have a lot of hesitancy when it comes to vaccines and even medical care. Speaking to that community, the African American community, with the past, the medical community has kind of put themselves in a position to not gain the trust of the African American community. What would you say to those who may have second thoughts or a little distrust in regards to the vaccine and the medical care?
That's a great question, and it's one that's been on my mind for some time, especially when we look at what's happened this summer. COVID has basically savaged the Black and brown community. We've seen increased hospitalizations and, of course, increased deaths in terms of rates among within our communities of color, and add in sort of Native Americans as well. Part of our reason for existing at the University of Houston is to try to tackle these health disparities, and it's deeply troubled myself as well as our dean, Dr. Spann, in terms of what we've seen happening with this virus. And we're concerned that a couple of things, could happen here. Vaccine hesitancy is real. So, I've seen it in my own clinic where I work. I work in the 3rd ward on the campus of University of Houston, and people have expressed concern about even taking the flu vaccine this year. It happens all the time, but flu vaccine is safe and it's been around forever. And, you don't want to catch flu and COVID at the same time. So that's why I've been pushing the flu vaccine this year. My worry is that our communities of color will be left behind again. We're seeing healthcare professionals getting the vaccine now. The plan for the distribution of the vaccine is going into clinics directly. And we know that some of our communities of color do not have good access to clinics.
Right.
And what we saw when all this sort of started, there was a lot of testing for those of you that live in Houston on the west side of town. So we're talking about the Cadies, the Fort Bends and stuff. And then on the east side, your Pasadenas, your, Settegast, your, 5th Ward, et cetera, 3rd Ward. There weren't as many COVID cases, but because we weren't testing as much. And then we started seeing people from those communities showing up in the hospital because we weren't necessarily identifying who had COVID and isolating them or keeping them away from others. My worry is that the vaccine distribution will wind up in those same communities where we're not, in terms of Black and brown, or traditionally Black and brown communities. And then, how do we get this life-saving intervention to them? And then will you take it? The healthcare community has been going through some introspection, especially in light of what happened this summer with the murder of George Floyd and all the protests. Everybody's sort of woken up that, hey, we need to do better. I think because all of us were at home and we saw this, and I'm proud of our young folks that took to the streets and really thought that things could change. I think most of us older folks were like, that's just how it is, But it's brought about an increased effort to do right and really do right by communities of color. And we have a vaccine that we've deemed to be safe. We've had African Americans working on this vaccine. The National Medical Association, there's the National Association of Black Nurses, They've met with Pfizer, they've met with Moderna, and all of their leadership is saying, hey, this vaccine is safe for communities of color, and we need to be sure that we get it out to them so that we're not continuing to have virus affect our family members, our friends, and taking their life too early.
So true.
I mean, a lot of people were like, well, they had diabetes. People have diabetes all day and they walk around.
Right.
Yeah.
Shows up, they get it, and 10 days later they're gone. Don't give me that. It's the virus.
Right.
And you know, so this is I think our best chance to kind of get things under control. And I'm when I have my opportunity to get the vaccine, I'll get it and post it on Facebook like all my friends that I'm jealous of right now. I'm really
Yeah.
people that with their nice shiny Band-Aids.
Dr. Reed, we thank you so much, especially just for providing that perspective for us, especially with your history of working in public health and being very informative on that. We really, again, thank you so much for your time. We thank everybody who viewed with us today and sent in all those questions. I will put in the chat, Dr. Reed shared with us some additional information if we want to do another town hall again, I believe from the Urban League.
Yeah, it was Urban League.
Yeah, talking more to our community, Black and Brown communities, of what we can really do to be informed. So I will put that in the chat for us. Anything else?
Dr. Reed, once again, I want to tell you thank you for taking time in your busy schedule, man. Every time I call on you, you answer and you're right there for us. Uh, I appreciate you, man. I appreciate you taking this time. And we appreciate everybody for tuning in too.
Yes,
Any last words, Dr. Reed?
No, thank you again for having me, Drs. Gilbert. It's very good to see you again, and I love what you're doing in terms of your marriage, medicine, and ministry. Really, really enjoy it. To the viewing audience, I hope everyone has a Merry Christmas and Happy New Year. Please stay safe. Continue to wear your mask, wash your hands, practice social distancing. Don't relax. Don't get sloppy. Now's not the time. We're getting close. We're getting close.
Right.
All righty. Okay, Dr. Reed, we're going to go ahead and let you go. Thank you so much.
Bye,
Merry
Dr. Reed.
Christmas to you.
Take care.
All right.
Bye.
All righty. Again, thank you all so much for viewing with us. We had a really good time. Thank you for all of the questions. Please, we want to stay connected with you. So we have all of the ways you can stay connected with us. Follow us at Marriage Ministry Medicine on all of the social media platforms. And then you can even take it old school. Just send us an email at Gmail. If that's saying Marriage Ministry Medicine at Gmail, if we need to take it old school for us. Anything else before we go ahead and let our audience go?
We are just so delighted that you tuned in with us. Please stay connected. We're going to have more informative sessions to keep you in the know of what's going on. I think that's it. Y'all be blessed, be encouraged, and we'll see you next time.
Bye-bye.
Bye.